Good morning, good afternoon, good evening, class. My name is Letitia Bland, and I will be introducing our team. We did the policy funding and collaboration review of the substance abuse service system as a collaborative. We have Kayla Boer, Ariel Clark, and Miranda Guitar, all that collaborated on this particular assignment, and we'll get this thing started. And so what I want you guys to do really quick is just familiarize yourself with some substance abuse facts in both Connecticut and California. These are the two states that we chose to analyze in this particular project. We wanted to show the contrast between a larger state and a smaller state that are representative of some of the most affluent in their particular states that have high affluent populations and also have high impoverished populations as well. And so we wanted to show kind of what substance abuse looks like across an economic scale for women in particular. So if you can just take a moment and look at these slides. I don't want to read everything to you, but just want you to take a look and familiarize yourself. And so next up is some additional statistics. We'll go into a bit more detail because what we wanted to focus on was women across economic groups. One of the more popular modes of research focuses on stay-at-home moms who are using different substances, be it alcohol, wine, boxed wine, or what have you, or using actual prescription drugs and maybe abusing those prescription drugs. So we wanted to discuss those rates in this project and also in the wiki that you'll see once you finish this presentation. So one of the things we really wanted to keep in mind is that the chronic non-medical use of opioids amongst men is twice that of women. So women are still the minority in this particular research set, but they still are a subgroup that is starting to show a rise in substance abuse statistics. We wanted to keep in mind that there are some legal and social concerns for mothers in particular because children can fall into social service systems in the various states, both California and Connecticut, and that could, of course, as we know, bode for a lot of other problems in the future for those children affected by mothers who have substance abuse. And of course, one of the bigger things we found out was that women are more susceptible to relapse and cravings, which only perpetuate the issue. And so we wanted to show you some statistics up front about why we felt as though this was a problem and a subset of people to take a look at.
Okay, so next we got the target population / social problem. Alcoholism in stay-at-home moms is an issue that can develop quietly over time and worsen without proper intervention and or treatment. Stay-at-home moms are in a challenging position. On one hand, the opportunity to stay home is a blessing, while it can often come at a price. Women who have a propensity for addiction or who don't know how to cope with stress can end up in a bad situation. They may drink alcohol or do drugs to deal with the stress and loneliness that comes with this lifestyle. Research suggests that women and single parents who use substances experience increased stigma because they do not obey the normative social expectations. Studies indicate that women are more likely to report stigma as a barrier to treatment when compared with men. Parental substance abuse continues to be a challenge for child welfare. Okay, so this article, Miranda, she actually provided these. According to the article published by the Child Welfare Information Gateway, favorably prevention and treatment approaches include promotion of protective factors, early indication of at-risk families, priority and timely access to substance abuse treatment slots, gender sensitivity treatment and support services, family-centered treatment services, including inpatient treatment for mothers in facilities where they can have their children with them, and programs that provide services to each family member. Also, recovery coaches or mentoring of parents to support treatment, recovery, and parenting, and lastly, shared family care. Okay, and this is a timeline of substance abuse policies and regulations. Starting in 1914, the Harrison Act. Just take a look at all these real quick. Just some major points. They all have their significance, but definitely in 1917, the War on Drugs. Also, in 1984, the Comprehensive Crime Control Act. And then the earliest is with 2003, the DMA and Illicit Drug Anti-Proliferation Act.
All right, so these are the current national services provided for substance use for women. The first one is the Affordable Care Act of 2010, and this makes health insurance more affordable for individuals, families, and small business owners. People living with mental health challenges or substance use disorders often have problems with getting private health insurance, and now because of this act, they are able to do so. Next is the Addiction Equity Act of 2008. And this requires insurance groups offering coverage for mental health or substance abuse disorders to make these benefits comparable to general medical coverages, deductibles, copays, out-of-pocket maximums, treatment limitations for mental health or substance abuse disorders. They must be no more restrictive than the same requirements or benefits offered for other medical care. Next is the Federal Workplace Drug Testing Act. And this addresses illegal drug use by federal employees, certifies executive agency drug-free workplace plans, and lastly, identifies safety-sensitive positions subject to random drug testing. And the last current national service is the Federal Regulation 42 CFR Part 8, and this provides for an accreditation and certification-based system for opioid treatment programs. The regulation acknowledges that addiction is a medical disorder, and that may require differing treatment protocols for different patients. So as stated before, we focused on California and Connecticut as our two states for this population. And so the California regulation, they have two main policies for California. The first one is the three strikes. In 1994, the California legislature passed what is commonly known as three strikes and you're outlaw, which requires a minimum sentence of 25 years to life for offenders who commit a third offense with pre-existing serious or nonviolent felony convictions to their name. And so the main one that affects California, especially for the women population that we listed below, is Proposition 47, which inmates convicted of crimes that are not legally considered serious, violent, or sex-related would be sent to county jails and not state prisons. So drug possession accounts for some of the common crimes in California, with over 20% of people convicted of these offenses could see their penalties either reduced or nullified because of this law. Proposition 47 made California the first state to stop using drug possession listing drug possession as a felony, and even being caught with methamphetamines or heroin will result in a misdemeanor charge. And so a lot of California drug experts have stated that this law created a decriminalized environment for substance abuse women and increased their likelihood of reaching care for different facilities. Within the last 5 years, California has made great strides to make changes to their laws and benefit this type of population. In 2017, they passed Senate Bill 823, which requires licensed treatment centers in California to adopt the American Society of Addiction Medicine's treatment criteria as the minimum standard for treatment. And it went to show that majority of licensed treatment centers only followed a 12-step Alcoholics Anonymous rather than medical-based practices for this population. So which really means they weren't receiving the correct care to stop their addiction and find the source of where all this was coming from. And according to the California Society of Addiction Medicine, this bill will provide standards for non-medical facilities and increase patient success rate. So for Connecticut, Connecticut has a very large opioid epidemic going on right now. And within the last year, 238 women have died from overdose in this state, which is why these main laws affect that population. So we have the Good Samaritan laws of 2011, and this was passed to protect people who call 911 seeking emergency medical services for an overdose, from an arrest, or from possession of drug paraphernalia. It does not protect someone from other charges or stops the police from serving a search or arrest warrant if they're already in process. We have the Narcan laws of 2012, and Narcan is used to stop the overdose process in people. And so this was passed to allow prescribers, physicians, surgeons, physician assistants, dentists, and pediatricians to prescribe, dispense, or administer Narcan to any person to prevent or treat a drug overdose, and the prescriber is protected from civil liability and criminal prosecution. In 2014, there was protection from civil liberty and criminal prosecution was extended to the person administering the Narcan in response to an overdose. And lastly, in 2015, an act concerning substance abuse and opiate overdose prevention was passed to help curb heroin and prescription opiate abuse through more streamlined prescription reporting, continued education requirements for practitioners, and greater availability of overdose revising drug, naxifloxacin, in case of emergency.
Okay, so the analysis of funding in California, it started with, they actually have MAT and MAT 2.0, medication-assisted treatment. The first one serves over 20,000 with opioid use disorder. California receives $90 million over a 2-year period. This is between May 2017 and May 2019. 2.0 is actually an expansion project. It increases the first point using 3 FDA-approved medications for treatment for OUD. This allocated $69 million per year up to 2 years. So it started in September 2018 and is ending in September 2020. Prenatal set aside in 2018 award was actually used for women specific service for treatment and recovery for substance abuse, including diverse supportive services for women and children in California. And then the SAPT Discretionary 2018 Award provides prevention and recovery services, including those of a specific population. These funds may be spent on planning, carrying out, evaluating activities to prevent and treat substance use disorders in pregnant and parenting women. Okay, next is for Connecticut. In 2018, Connecticut actually received a $10 million grant to be used to increase care for individuals with substance abuse disorders. This was actually and will be used to help over 2,000 individuals. This allows physical health providers to treat those with mental health and substance use in Bridgeport, Hartford, and Waterbury. These areas have high rates of patients who have high Medicare, Medicaid expenses, and behavioral health diagnosis. Also, the 21st Century Cures Act, intended to improve medical technology and innovation. $1 billion has been allocated for over 2 years to fight opioid addiction and overdose, which actually killed 49,068 people nationwide in 2017. And Connecticut's people actually tend to use their Medicaid funds more slowly, so overall Connecticut used 82.5% of that, 5,500 to serve 1,010 people.
All right, so to kind of wrap this up, we wanted to discuss some of the interagency coordination. So you heard the policies and the acts and all of those, all the legislation, all the funding that has gone into trying to ratify the problems of substance abuse in both Connecticut and California. And so now we want to talk about how those agencies are working together in their respective states to make the problem better. So in all cases of substance addiction, having a safe environment is vital to recovery. The healing, it's vital to the healing and the longevity of and sobriety of the addict, and that's really what these agencies are coordinating to make happen. It's very much true for women who have been subject to physical or emotional abuse, and as the policies and approaches to treatment change with regard to substance abuse, both California and Connecticut have really done their due diligence to keep up with the times. There are a few hundred facilities within the state of California that are dedicated to helping women with gender-sensitive substance abuse problems, as we've alluded to earlier. The overarching organization, the California Health and Human Services Agency, they oversee several offices that provide a range of social services, mental health services, alcohol and drug services that will cater to the population, which will serve to hopefully reduce the rise of substance abuse and specifically women's substance abuse in the state of California. And the CHHS actually works with both international and national agencies to kind of further this agenda and making sure people are getting the care that they need, but also reducing their access to illicit drugs that are coming into the country, into the state. So conversely to that, one of the things our group discussed was that Connecticut is not as progressive as California in how they are addressing the issues, but they are progressing. And one of the agencies that kind of works pretty hard on that is the Department of Mental Health and Addiction Services, or the DMHAS. There are a few services that are gender sensitive in Connecticut. The majority of those addiction treatment centers in Connecticut mainly accept both genders, so there really isn't one particular place that only caters to women like it is in California. And part of that is probably because the states are so different in size. So there's about 25 substance abuse facilities in Connecticut, and they do have programs that are dedicated to women who are struggling with drug and alcohol addiction. Let's see. So the Department of Mental Health and Addiction Services is a healthcare agency, and they want to promote essentially holistic overall health and wellness for Connecticut and for their substance abuse sufferers. Essentially, both states are seeking to provide dignity and respect and self-sufficiency to all those in need, both women and men, but really want to provide a holistic approach. And part of that holistic approach is gender-sensitive treatment. Next slide, please. All right, so some of the other intervention organizations that do exist, just wanted to give you an overarching review of what some of those are, and they're working more at the macro level with both international drug efforts, justice efforts in terms of prosecuting international crime as it pertains to drugs, as well as some things that are going on that are nation specific. So some of the organizations you'll see here, for example, the Bureau of International Narcotics and Law Enforcement Affairs, they essentially have an international demand reduction program that thwarts international crime through justice efforts, and that's essentially cracking down on distribution, as well as programs that develop and sustain drug prevention efforts. We also have the United Nations Office on Drugs and Crime, that's the UNODC. They do drug abuse prevention and health programs, and it's government funded, which is awesome. They're kind of funded by various governments they work with at an international level. So essentially, the whole world is working on this problem, which I think is fantastic. Of course, we all know who the World Health Organization is, essentially doing international public health services. They do a lot of the advisories and research that we've been able to look at for this particular population. We have the Organization of American States Inter-American Drug Abuse Control Commission, and they're essentially reducing the production and trafficking of illegal drugs within America. So this is one of those nation-specific organizations. And then finally, one of the more famous ones that are in a lot of the research as it pertains to American substance abuse is the National Institute on Drug Abuse, or NIDA, and they essentially are trying to advance the science, the scientific study and the research on why people use drugs, why which populations use drugs, and they're really leading the charge on finding out looking at the rise in trends of women's substance abuse in really all economic spectrums. Next slide. And so we wanted to analyze some of the strengths and weaknesses of both states and how their agencies are working together to mitigate the problem. And I'll start with the weaknesses only because one of the weaknesses that we did cite is that there really is not enough research that is drawing these references between economic status, gender-sensitive treatment, and substance abuse. And so although those three very popular topics in our society, those three together are not so popular. And that's one of the things that we cited is a weakness, because we really do want to see what the impoverished population who deal with a bunch of mounting social issues that may lead to drug abuse versus maybe more affluent communities that also have rising rates of drug abuse, and what those differences are across gender and across types of drugs and all those things. So that's one of the weaknesses that we cited. Another weakness that we cited was that there needs to be more gender-focused treatment. So that's kind of a new topic, a new way to approach this particular predicament in our society, is to have more gender-sensitive programs so that women who deal with certain issues that are culturally women-centric, socially women-centric, even physically women-centric, like we have children, and how addiction plagues us versus how it plagues men in their multiple phases of substance abuse that affects the male community in the United States. And so some of the strengths that we did notice because of some of the weaknesses is that there is an awakening to the epidemic. So essentially we're starting to see people doing research on the rise of substance abuse amongst stay-at-home moms, which is kind of a subculture of women. And we're starting to see that get some shine, and the shine that it deserves. We're also seeing that, for example, examining both states, both Connecticut and California, that they really are pouring their resources into these treatment options. And so one of the treatment options that Ariel highlighted earlier was that there's more of an evidence-based treatment option instead of just a 12-step program, which is more of a great emotional, holistic way to approach things. The evidence-based treatment method is kind of the converse of that, which is also getting to the same endpoint of preventing relapse and making sure people are getting better and getting over their addictions. And one of the final strengths that we noticed was that some of the programs, California has been incredibly progressive in how they've addressed substance abuse in that state. And one of the ways that they've addressed it is Medi-Cal, or in other international interventions, the different programs that we mentioned earlier. So Medi-Cal is essentially like the Affordable Care Act for California. It essentially is geared towards low income households, and Medi-Cal specifically offers treatment services and mental health services for people who are suffering with substance abuse. And so it's essentially reversing the effects of the war on drugs, as we mentioned earlier, which criminalized addiction instead of treating addiction as what it is, which is a disease. And so those are some of the strengths and weaknesses that we kind of found in our research. And so essentially, in conclusion, you can advance. You'll see some of our references here, but what we really wanted to get at was that substance use and abuse and dependence are really barriers to self-sufficiency. And that's essentially the goal of what we as social workers want to have for our the various populations that we work with. We want our populations to have dignity, respect, and self-sufficiency. That's what we said at the beginning. That's really what us as social workers want to see in the populations that we work with. And so that's what this project and this research set is hopefully giving you all. Hopefully the wiki page will also give you some more kind of honed in points that you can focus on, some videos, some articles that we've researched, and things that you can reference to advance your knowledge of this problem. But that's all I have. That's all we have.
Thank you.
Thanks for watching.
Thanks for watching.